Pregnancy brings about a lot of change, and many women are unable to accept the change that pregnancy has brought about. And they want to have their pre pregnancy body as soon as possible after their first delivery. You can very well have a tummy tuck surgery after your first baby and before you plan your second baby. Tummy tuck is one of the most impactful procedures in aesthetic surgery, and it changes your overall look for the better. Women opt for it for different reasons, be it body contouring after their pregnancy or after immense weight loss. So the reasons may be different, and of course, the age at which they present for this procedure is also different. In this video, let us discuss what is the right age for a tummy tuck surgery. Now, to make it simpler for you to understand, let us divide the age group into three segments. The young age group, which is 20s and 30s, the middle age group, which is 40s and 50s, and the advanced age group, which is more than 60s. Now, when we consider tummy tuck at a younger stage, which is in the 20s and 30s, it may be due to two reasons. One is, of course, post-pregnancy body contouring, and the second one is after massive weight loss, and you would want a better body, which is not achieved only with the weight loss. So, in this age group, of course, you are at your healthiest, and you can combine different procedures together with your tummy tuck. Your recovery would also be quicker when we compare it to the other age groups. Some mothers, again, are very advanced planners, and they want to plan their tummy tuck even before they plan their pregnancy. And they are in fear of having a totally changed body after the childbirth. Pregnancy brings about a lot of change, and many women are unable to accept the change that pregnancy has brought about, and they want to have their pre-pregnancy body as soon as possible after their first delivery. You can very well have a tummy tuck surgery after your first baby and before you plan your second baby. But yes, you need to be aware that whenever you plan your second child, you may very well do so, and your second pregnancy per se will not be anyway hampered with your tummy tuck surgery. But yes, after your second baby, you may need to have a revision tummy tuck, or you may need to work extra hard to have the same result as your first tummy tuck. Now, let's consider the middle age group, the 40s and the 50s. This is again a very good time to have a mommy makeover surgery, because you can actually take out some time for yourselves from your busy schedule. And the most common age group that comes to me for abdominoplasty is really the late 30s and until the 50s. So this forms the major chunk of women who are wanting to have body transformational surgeries. Again, this is a good time, because if you're in good health, you can definitely plan your other surgeries along with the tummy tuck surgery. And I very often combine breast surgeries and tummy tuck surgery together. I'm mentally more mature to take this decision for themselves. I would just like to put in a special note for women above 50 over here, because 50s is the age that many a times we have different comorbidities affecting us, like hypertension or diabetes. If you have these conditions well within control, then you can very well safely plan your mommy makeover journey or your tummy tuck surgery. Now let us look at the advanced stage, which is more than 60. Now, when we are considering body contouring procedures for women above 60, it can again very well be done. But here, of course, we need to take care of the health in general, and when we are deciding about multiple procedures. And this is an age where many women would definitely want other parts of the body contour, for example, the arms or the breasts, along with the tummy tuck surgery. So here we need to take a pause and see how the health condition is going to allow us to do this in the most safe manner. And in these cases, I generally recommend my patients to have it in separate sessions. And if the health is actually very good, then we can definitely combine a small procedure along with the tummy tuck surgery. But of course, health is the priority and safety is the priority. So we need to plan it in such a manner so that your recovery after each procedure is quick and you can get back on your feet in a better way. My oldest patient for a tummy tuck surgery has been in her late 60s, and she's recovered uneventfully and is enjoying her result. So obviously, age is no barrier to plan your body contouring journey. But again, we have to be mindful of our health, that we keep in good health when we are planning this surgery, and recovery is tremendously important in a positive result. So I hope that this video about the right age for tummy tuck surgery has helped you and will help you in deciding as to when you want to plan the surgery for yourself. If you have questions regarding your mommy makeover, please drop them in the comment box below and I shall be very happy to answer them. Do not forget to like the video and share it with your friends if you found this video informative. Don't forget to subscribe to SB Aesthetics and keep the notification bell on so that you can get notifications for the new videos.